presents Count on Health.
And the surgery is a knee replacement. You know, there's been lots of different types of knee replacements. You hear partial knees and total knees, and there used to be female knees, and there was never a male knee, so we kind of got shortchanged on that. But there really is no difference between a female and a male anatomy of a knee, so that women's knee was really more of a marketing gimmick and never really panned out to be anything more than that. Partial knee replacements, kind of the same way. I mean, people kind of hung that shingle on their door years ago, trying to make it sound like it was an easier surgery with a quicker recovery time, but they were doing it on the wrong patients, and a lot of those patients would end up coming back and having to have a regular knee replacement done. Treatment is always conservative, and we really do try to maximize that. The worst thing you can do is recommend surgery for somebody when they have had no other treatment before, because if that patient doesn't do well with surgery, then they're not going to be happy. So a total knee replacement is pretty much the gold standard. It's basically two metal pieces with a plastic piece. You know, and what they do is they basically get rid of the arthritis and straighten the deformity of the knee and allows the patient to walk without having the pain and the instability that they had beforehand. The recovery is a lot different nowadays. You know, a lot of it's insurance driven, but nowadays it's an overnight stay. Most patients, I would say probably 90% of my patients go home the next day. They don't go to rehab anymore, they go home. Therapy starts day one, they're walking in the hallway that day, and the recovery time, you know, within about 6 or 8 weeks, they're pretty much up walking around, not using a cane anymore. Still having some pain and swelling, but doing pretty well. Definitely recovery time for knee replacements is longer than hip replacements. Hip replacements, usually by 6 weeks, the patients are doing great, and we're having to tell them to slow down, but with knee replacements, it's the other way around. They take a while, but in the end result is a much, much better knee. It's not a perfect knee, but it's a lot better than what you started with.